Simvastatin side effects and how to manage them. Simvastatin, also known by the brand name Zocor, is a prescription statin medication used to improve cholesterol levels and support heart and blood vessel health. While highly effective, simvastatin can sometimes cause side effects such as muscle pain. It's important to note that muscle pain from statins is less common than many believe, and there are effective ways to manage it, including adjusting the dosage under a healthcare provider's supervision. Other commonly reported simvastatin side effects include headaches, abdominal discomfort, and constipation. Most people taking simvastatin do not experience any side effects. However, being informed about possible reactions and knowing when to seek medical help can make your treatment safer and more manageable. By understanding what to expect, you can prepare for potential challenges and take steps to prevent certain side effects from becoming serious. Consulting your healthcare professional is key to creating a personalized plan for managing any symptoms that may arise. 1. Upper respiratory infections, URIs. Upper respiratory infections are among the more common side effects linked to simvastatin. Symptoms may include a runny or congested nose, sore throat, and cough. Most URIs are caused by viruses and tend to resolve on their own within about 10 days. During this time, over-the-counter cold or flu medications may help relieve symptoms. If symptoms persist beyond 10 days, a bacterial infection could be the cause, requiring antibiotics. Seek immediate medical attention if you experience a prolonged fever, chest pain, or shortness of breath. 2. Dizziness and increased fall risk. Some people report dizziness or balance issues when taking simvastatin, particularly adults over 60, which can increase the risk of falls. If you feel dizzy, sit or lie down until the sensation passes, and avoid activities that could be dangerous in that state. If dizziness or balance problems continue after starting simvastatin, consult your healthcare provider to determine whether the medication is contributing to the issue. 3. Irregular heartbeat, atrial fibrillation. While some people notice a fast or irregular heartbeat after beginning simvastatin, clinical trials have shown that this symptom occurs at similar rates in people not taking the drug. In fact, research suggests statins may lower the risk of atrial fibrillation, AFib, in individuals with normal heart rhythms and reduce stroke risk in those already diagnosed with AFib. Because coronary artery disease itself can increase AFib risk, it's important to monitor your heart rhythm closely. If you notice a rapid or irregular heartbeat while on simvastatin, contact your healthcare provider promptly for evaluation and guidance. 4. Headache. Headaches are a relatively common side effect of simvastatin and may improve as your body adjusts to the medication. However, headaches can have many causes, so it's important not to assume simvastatin is the only reason. If headaches become bothersome, your healthcare provider may recommend an over-the-counter pain reliever or suggest lifestyle adjustments to help reduce discomfort. For persistent or severe headaches, especially those accompanied by confusion, fainting, unusual intensity, or worsening when lying down, seek immediate medical attention. 5. Abdominal pain. Abdominal pain can occur with simvastatin use and may be linked to various underlying causes. Inform your prescriber if you experience the symptom, noting where the pain is located and whether it changes over time. Severe abdominal pain accompanied by yellowing of the skin or eyes, jaundice, and swelling can indicate serious conditions such as liver damage. These symptoms require prompt medical evaluation. If the pain is intense or worsening, go to the nearest emergency department. 6. Constipation. Constipation is another possible simvastatin side effect. Staying hydrated, eating a fiber-rich diet, and remaining physically active can help reduce symptoms. If these measures are not effective, ask your pharmacist about over-the-counter laxatives and the best options for your situation. If constipation becomes painful, persistent, or accompanied by other symptoms, contact your healthcare provider to determine whether simvastatin or another factor may be contributing. 7. Nausea. Some people experience nausea while taking simvastatin. Since simvastatin can be taken with or without food, try pairing your dose with a light meal or snack if nausea occurs. The liquid form of simvastatin, lipid, however, should always be taken on an empty stomach. If nausea continues or you experience vomiting, speak with your prescriber. They may recommend an anti-nausea medication or adjust your treatment plan to improve tolerability. 8. Itchy skin, eczema. Simvastatin can sometimes be associated with itchy, dry skin, or eczema, particularly in individuals over 60. While the exact cause isn't fully understood, moisturizing regularly with products like Aquaphor or Vaseline can help prevent dryness. 4. Flare-ups. Short-term use of low-potency topical steroids, such as hydrocortisone, may help reduce itching. If symptoms persist, consult your healthcare provider for additional treatment options or possible dose adjustments. 9. Muscle pain. Muscle pain is one of the most frequently discussed simvastatin side effects, but research shows it is often unrelated to medication. When statin-related muscle pain does occur, it may be more common in those taking higher doses, older adults, or individuals with kidney problems. Certain medications, such as amlodipine, Norvasc, and verapamil, can interact with simvastatin and increase the likelihood of muscle pain. Your prescriber may recommend lowering your dose or switching to a statin with a lower muscle-related risk. If you experience muscle pain, report it to your healthcare provider. They can assess the cause, adjust your dosage, suggest a temporary break from the medication, or explore alternative statin options that may be better tolerated. 10. Severe muscle damage, rhabdomyolysis. Although rare, simvastatin can cause severe muscle damage known as rhabdomyolysis, a condition that can lead to kidney failure when muscle breakdown products block the kidneys. Key warning signs include muscle pain, significant weakness, and tea-colored urine. If you experience these symptoms, contact your healthcare provider immediately. Rhabdomyolysis requires urgent hospital treatment to protect kidney function and prevent further complications. 11. Liver damage. Simvastatin can affect liver health, sometimes causing changes in liver enzyme levels shortly after treatment begins. For most people, these changes do not cause symptoms and resolve over time. However, serious liver damage is possible, especially in individuals with a history of liver problems or those who consume large amounts of alcohol. Seek medical advice promptly if you notice symptoms such as loss of appetite, abdominal pain, dark urine, weakness, fatigue, or yellowing of the skin or eyes. Your healthcare provider may monitor liver function with blood tests at the start of treatment and periodically thereafter. If liver enzymes are elevated, dosage adjustments or a temporary pause in treatment may be recommended. 12. Increased blood glucose levels. While simvastatin helps reduce the risk of heart attack and stroke in people with diabetes, it can also raise blood glucose levels. This is because statins may affect how well insulin functions in the body. If you have diabetes, your provider may recommend closer blood sugar monitoring during treatment. For those with diabetes risk factors, lifestyle changes such as regular exercise and a balanced, low-sugar diet can help reduce the likelihood of developing condition. Despite this potential side effect, the cardiovascular benefits of simvastatin often outweigh the risks, and statin therapy remains a recommended treatment for many people with diabetes. 13. Memory impairment and confusion. A small number of people have reported mild memory loss or confusion while taking simvastatin. These symptoms generally improve once the medication is discontinued. However, current research does not strongly link statins to cognitive decline. In fact, some studies suggest potential protective effects on brain health. If you experience memory changes, speak with your healthcare provider to assess whether simvastatin may be a factor. Do not stop taking the medication without professional guidance. When to contact your healthcare provider. Most simvastatin side effects are mild and manageable at home. However, contact your prescriber if you experience persistent, bothersome, or concerning symptoms. Some effects, such as increased liver enzymes or elevated blood glucose, may require ongoing monitoring as part of your treatment plan. Seek immediate medical attention for serious warning signs, including muscle pain with weakness and dark, tea-colored urine, possible rhabdomyolysis, abdominal pain with yellowing of the skin or eyes, possible liver damage. By staying informed about simvastatin side effects and how to manage them, you can take a proactive role in your health, reduce risks, and ensure the medication works effectively for your cardiovascular protection. Always work closely with your healthcare provider to tailor a plan that balances benefits and safety. Common simvastatin, Zocor, side effects include upper respiratory infections, headaches, and abdominal pain. Constipation, nausea, and muscle pain may also occur. In rare cases, more serious side effects are possible, such as severe muscle damage, liver injury, and elevated blood glucose levels. If you experience any symptoms that concern you, speak with your prescriber or pharmacist. They can help determine whether simvastatin is the cause and recommend the best next steps to protect your health. For more trusted science-backed health information, subscribe to the HeInfo channel, your all-in-one destination for reliable medical guidance, expert insights, and practical tips to help you take charge of your health.